Hey everyone, it's Shakira, aka the Dope Doula, and I'm back with another educational video for you all today. I just want to give a trigger warning that this video is going to be about miscarriage and pregnancy loss. So if you are someone who might be easily triggered by any conversation related to miscarriage and pregnancy loss, this is the opportunity for you to turn this video off. I want to make sure that this is a safe space for everyone. October is Pregnancy and Infant Loss Awareness Month. Recently, Chrissy, Teigen, and John Legend shared the news of their pregnancy loss. The details around what happened are still unclear, and quite frankly, no one's business. It was a really profound move for Chrissy and John to share that information, and they receive overwhelmingly a ton of support from their fans, just letting them know that they have community. And at the same time, they also received a lot of scrutiny for their transparency. If you're unfamiliar, Chrissy made a post with images that were taken in the hospital shortly after they realized that they would lose their baby, that the baby was not going to make it. I do want to note that in instances of a stillbirth, photographers are quite a common practice. There were a lot of questions around why would they photograph that. It's a common practice when there's a stillbirth. It allows the parents to be able to document that moment and have images of their baby, knowing that they're not going to be able to take their baby home. Given the amount of scrutiny, it is a reminder that the conversation related to miscarriage and pregnancy loss is still very much taboo. About 10 and 15 out of 100 pregnancies do end in a miscarriage and or a pregnancy loss. That's about 10 to 15% of all pregnancies. That is quite common. And even though it is quite common, there's still so much that people don't know about what it means to have a miscarriage, the different types of miscarriages, what's the difference between a miscarriage and a stillbirth. And so I want to use this as an opportunity to talk about some of the different types of miscarriages to ensure that as a community we are properly educated, and as we're entering conversations with ourselves, our community, our partners, that we're using the right type of language, that we're talking about this from an informed place. First off, as I mentioned a moment ago, miscarriage is quite common. It does happen regularly. And the more that we can normalize the conversation, the more that those who experience miscarriage are able to grieve openly, to share their stories more openly, and to know that they exist within a community of others who have gone through the same experience. There are very different types of miscarriage. Most people hear the term miscarriage and I'm assuming, think one generalized circumstance for all people, but that's not the case. So let me walk you through the different types of miscarriages that can occur. The first is a threatened miscarriage. So this is when someone who is pregnant may start to experience some abdominal discomfort. They may also start to experience a recurrence of bleeding and cramping, and may start to get a lot of the pain and symptoms associated with a miscarriage that does not necessarily lead to a full and complete miscarriage. In these instances, if someone is going through the process of experiencing recurring bleeding, sometimes early in a pregnancy, Light spotting can be normal, particularly in the first few weeks. But after that, if there is a persistent, heavier flow of bleeding, that could be an indication of either a threatened, or as we'll talk about in a moment, a complete miscarriage. So a threatened miscarriage is when someone starts to experience the symptoms of a miscarriage, but doesn't necessarily experience the complete evacuation of a fetus or their baby. The second is inevitable miscarriage. So this is when a threatened miscarriage actually takes course into a completed miscarriage. And in this instance, there is very little intervention that can be done to stop a miscarriage. In this instance, this is when the pregnant person will have to connect with their midwife, doula, and medical care provider to talk about the next steps and course of action if they are in the process of miscarrying. Then there is also a missed miscarriage, and I know that can be confusing. So a missed miscarriage is when the body, the fetus or baby does experience a death, but that the body doesn't recognize that the baby has passed. In this instance, the pregnant person will actually need the support of their medical provider to help evacuate the baby from their uterus. And then there is also the incomplete miscarriage. And this is when the body does start to go through the process of a miscarriage, but all of the bleeding and all of the evacuation does not fully complete. Again, in this instance, this is when the pregnant person will need the full support of their medical provider to evacuate the baby. In an instance of a miscarriage, medical intervention is always needed, and a miscarriage can often be completed at home through the use of medicine that will encourage the evacuation of the fetus or baby to draw out over time, with some support from, and supervision from your medical care provider. And then there are times where, in the instance of an incomplete miscarriage or a missed miscarriage, a pregnant person will need to get what's known as a D&C, with a medical care provider actually evacuating the baby. So those are some of the different types of miscarriage. There's a lot of misconception around what can actually cause a miscarriage. A lot of people often associate stress or certain external factors with miscarrying. And while stress can certainly create stress on the pregnant person and in many instances catalyze labor too early, miscarriage is most commonly triggered by genetic abnormalities. Some OBGYNs like to frame a miscarriage as nature's way of determining that the genetic makeup of an embryo is not qualified for sustaining life, and so the body will go through its natural process of evacuating the embryo or the fetus or the baby. I want to pause here and say that whatever the cause, it doesn't take away the pain that people feel when they experience a miscarriage, and it certainly doesn't take away the need for support and the grieving process. Even knowing that it's common doesn't take away the fact that if you are someone who experienced or experiences a miscarriage, it will still very much hurt. And for a lot of people, there can be shame and feeling like their body has failed them in some way. That said, knowing that often the body is naturally finding ways of correcting itself, of ensuring that life can be sustained in the body, can provide a little bit of solace in knowing that ultimately there is often nothing we can do if a miscarriage, a threatened miscarriage occurs, and then it becomes a complete miscarriage. The difference between a miscarriage and a stillbirth. So a miscarriage tends to occur before the halfway point of a pregnancy. So before the 20th week of a pregnancy is defined as a miscarriage. And anything after the 20th week of a pregnancy is considered a stillbirth. It is my understanding that Chrissy Teigen was just about halfway through her pregnancy. And so, without having full context of the situation, with the very limited knowledge that I have, I would say that what she experienced would be classified or could be classified as a stillbirth. There are also pregnancy losses in the different types. Ectopic pregnancy is when the baby and the fetus begins to form in one of the fallopian tubes and is not able to form within the uterus, and that is a pregnancy that would need to be evacuated to ensure the health and safety of the pregnant person, because an ectopic pregnancy, if not properly handled and or recognized, can create some long-term health impacts for the pregnant person. And a lot of times people who do experience ectopic pregnancy often don't realize it until a little bit later in their pregnancy. And the other type of pregnancy loss is a molar pregnancy loss, where the baby does not fully form as the fetus doesn't fully form into the baby as it should, and is not growing to the milestones as it should week over week. And so that is often a type of pregnancy loss that those who go through the experience of a birth evacuation would experience. If you are someone who has experienced a miscarriage, there are plenty of resources, a miscarriage or a pregnancy loss rather. There are plenty of resources through organizations like March of Dimes, Planned Parenthood, the American Pregnancy Association, who will be able to provide mental health support services and communal services to ensure that you are, one, fully able to go through the grieving process with experts who can adequately ensure that you're informed of, if you do consider getting pregnant again, what that process needs to look like. There are also trained midwives and doulas like myself who are able to support people who have recently experienced a miscarriage, a stillbirth, or a pregnancy loss. If you have any questions about what other things you might want to look out for in terms of just knowing where you might be at risk for a potential miscarriage, there are other behavioral factors that tend to be more on the extreme form of habits. So things like extreme alcoholism or drug use can be other ways that habitually and through behaviors people might experience a miscarriage. If you are someone in need of support or services, you're more than welcome to reach out to me. You can send me a DM. You can drop a comment in the comment below. I'd be happy to follow up with you. And for anyone who has recently experienced a miscarriage or is going through the process of a miscarriage, my compassion and heart is with you. You are not alone. You have community. You have people to support you. And I do believe that for anyone who is believing again to be able to get pregnant again, that you can experience your rainbow baby on the other side of this moment. All right, be sure to like this video, share it with someone who you think might need to hear this conversation. Please be sure to subscribe to my channel and follow me on Instagram, and I will talk to you all again very soon.